Hi, how are you? My name is Jamie. I am a lactation consultant here at University of Maryland and have my coworker here.
Hi, I'm Christina, also a lactation consultant at University of Maryland.
And we want to show you just a little bit of an overview about our Medela Symphony breast pump. When you get this breast pump, it comes on wheels to be rolled into you. You plug the pump right into the wall, and it comes with a pump kit. The pump kit comes with little flanges, comes with two sets actually, so it's going to come with a number 24. And obviously nurses can help you take a look at it, but we want to just size it up with the tip of the nipple, and just to make sure the tip of the nipple is fitting inside this little tunnel portion. And if it looks like it doesn't fit, you can size up to the next size. But when you turn the pump on is how you will kind of really tell which is comfortable for you. Basically what you don't want to happen is you don't want the tip of the nipple to be rubbing on the insides of the flange. And so first thing that you want to do is you want to place the tubing onto the pump. And so you'll hear a little click when you do it. And you do want to make sure, because even sometimes when I set this up, they pop off. So you just want to make sure that they're nice and firmly placed in there. Perfect. And that locks it in. And then the air kind of flows through here, so you do not have to clean out the tubing. Actually, the air does not come back into our machine. That's what basically makes it hospital grade. So it's a multi-user pump. Then when you take your portion together, which you will do obviously with, if I were you, I'd probably just do it with gloves. If you want to, whoever's cleaning it, you can take all these parts apart. And this is kind of how you put it together. So you take the white piece, you place the white piece back into the yellow piece, and then you take the yellow piece and you place it back into the clear piece, and then you place the bottle on this way. And so those are all the pieces that actually would be cleaned, including this part here. And so that's actually how you put it together. Then you take the tubing and you place the tubing inside of the pump. And so we can do both of them. This is the same way. Put it back on and put it together. It's like a little puzzle piece almost. And then in order to get you started, what we do is we push the circle button, and then we hit the drop button. The drop button means it's initiation mode, which means it's going to mimic the suckling of a baby. And then you can turn it up, and when you'll do it, you'll turn it up just a little bit for comfort. And basically you want to see, is it comfortable? If it's comfortable, and then you wait a couple more minutes, you can dial it up a little bit more if you want to. Suction is important for milk to flow, but it's not going to, we don't want to like hurt you either. We want you to be nice and comfortable. This cycle goes on for 15 minutes, and you want to make sure you're doing this at least every 3 hours, or we want to make sure it's at least 8 times in 24 hours. Sometimes if it's rubbing, like I said, the nipple would actually be touching the insides of the flange here, and so then you would go up on your flange, and so you could just kind of take it off, and then you would just change out, and you can see the difference in sizes. After a while, you'll be able to look at one and be able to tell if it's larger than the other. And so after, you would keep pumping on this initiation mode until you get 20 mLs. So that means on the bottle, 20 mLs times 3. And then after that, then you would come back to your pump the next time you pump, and then you would just hit the circle button. The circle button is just maintain mode, and then you would then also dial it up for comfort. I guess, and then milk storage, right? So we want to undo your bottle. We will put your lid on. We have labels that we print, and you want to date and time your labels. Your label will have your name and your MRN number on it. And then it can sit on your bedside table for 4 hours. And then we would put it on ice for 24 hours, and your nurse would make sure that they keep placing ice in the bucket. Your spouse, if the baby is not here, can take it to your baby. Maybe we could bring it downstairs and they could pick it up. If your baby's in the NICU, us lactation consultants could come pick the milk up and transport it to the NICU if we need to. And anything else? Breast milk is very important right now. Breast milk is really anti-infective. It has immune properties in it, and it's the best thing for your baby right now. So with everything you're going through, and your body can still produce milk, it's amazing what we've seen.
Yep.
Women that are very sick and ill, and how much we've been able to collect from these moms. It's magical. It's amazing.
So the CDC, the Centers for Disease
Right.
Control, and the World Health Organization recommend breastfeeding your baby if you have the flu or if you're positive for COVID-19. They recommend good hand hygiene, mom wearing a mask if she's breastfeeding. So good hand hygiene before and after breastfeeding.
Right. Yep. And then after you're done, we would clean these with soap and water. Basically, we'll give you a basin, we'll give you washcloths, these little white cloths, soap, which is just the natural, it's like organic, is it, or all natural soap, I guess it is. And then you don't want to soak your parts in water because the water can have bacteria in it, so you just want to wash them just like you wash your dishes at home.
Warm soapy water.
Warm soapy water. And then rinsing them, making sure all the bubbles are out of it. And then they would air dry right in your room. And then you would just use them the next time. Just make sure everything's nice and dry before you use it. We'll give you lots of bottles to use. So we don't really wash the bottles. They don't get reused. We just throw them away. The bottles that we give you are nice and clean each time.
And then once mom's making more milk, we'll increase bottle sizes from the little ones.
Yep, perfect. And then we'll also help you get a breast pump from your insurance.
Mm-hmm.
Yep. Any questions, you can just call us at 443-915-2748, and that number can be called 24 hours a day, and we will just call you when we get back into the office. Someone's here every single day. Thank you.
Thanks,
very
guys.
much. Bye.